Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Right. In the secondary glaucomas, we have pigment glaucoma. Pigmentary glaucoma. Okay. In the pigmentary glaucoma, here there is a syndrome called as pigment dispersion syndrome. In the pigment dispersion syndrome, here actually there is a syndrome called as pigment dispersion syndrome. In the pigment dispersion syndrome, there is formation of the pigments will be seen, and these pigments will go and they block the trabecular meshwork, and they also block the Krukenberg's spindle. So the pigments present in the pigment dispersion syndrome, they will go and they will block the trabecular meshwork, and they will cause iris trans illumination. Because of the blockade of the trabecular meshwork, number one, there is primary open angle glaucoma is seen. The angle is normal, but these pigments are blocking the trabecular meshwork, thus resulting in primary open angle glaucoma. Along with that, the patient will also develop iris trans illumination and Krukenberg's spindles are seen. Treatment is done similar to the primary open angle glaucoma. Treatment is done similar to the primary open angle glaucoma.
thank you and thank you for watching.